Good afternoon, everyone. Thank you for joining me today on another session of Healthier You from Oswego Health. We're here to bring you all of the monthly updates on how to live a healthy lifestyle. And I'm very happy to have with me some great discussion today about orthopedic care. So I'm Katie Pagliaroli, Vice President of Clinical Services and Integrated Healthcare. And I'm joined today by Brandon Weaver, one of our PAs at our Center for Orthopedic Care, and Jason Pratt, one of our physical therapists. And we're so happy to have both of you. I know we have a lot of great questions already started for the day as we head into summer and we're talking about injuries and prevention. So I'm going to start asking some questions. Thank you for taking the time to join me today. Brandon, I'm starting with you. So first of all, I wanted to congratulate you because Fulton Lacrosse, the team just claimed their first regional title in program history, which Brandon is the head coach. So very, very big congratulations on that. And we know sports are a great way for everyone to have some activities, get some exercise and have fun. But we also know that they can come with a risk of injury if they're not careful or if they're not participating the correct way. So what are some ways that you have to prevent injury during the sports season?
Well, first, thank you for having me and Jason here today. And also thanks for the shout out for the girls varsity program. It was a great season and we really enjoyed the run, and we look forward to getting back to it next year. But regarding injuries, I mean, you can't prevent all injuries. I think the biggest thing is you need to take the steps to try to reduce the risk. And that comes in a variety of different ways. It depends on the activity. Obviously, you want to take any activity, you start slowly, kind of making sure that you understand what you're doing, using proper technique, warming up correctly prior to doing activities. I know with my girls team, we make sure we do good dynamic stretching, which is stretching with movement. Before any activity, before practices, before games. So we hopefully reduce the risk on the field. But a lot of that injury reduction comes before you get onto the field or your activity. And that, can be done through proper strength training, proper flexibility training, and wearing the proper gear and everything.
Great. So prevention is key, and that's one great way that we can do that. Next, I'm going to Jason. So Jason, also very involved with sports on the Little League board here in Oswego, baseball coach, done a lot of different things. So Jason, if we have tried to prevent, but we get an injury, what is a way that we can treat an orthopedic injury after the fact?
So initially you're dealing with the inflammation, the acute inflammation for like the first probably 2-3 days maybe. So you're looking at trying to use the Price principles, which is to protect, rest, ice, compression, and elevation. That's the standard go-to, and for the first few days where you just kind of lay low, don't do too much, put some ice on it, watch some Netflix, relax a little bit. And you might want to consider bracing as well to further rest it, to mobilize the area. And if that doesn't get better in a couple of days, then you might want to start thinking about coming to see Brandon, and then if he decides that might be something that you might have to get a little bit more help with to help with the healing process, you might send you to therapy, or you might need to see some other. You get some more help with an athletic trainer if they're a young kid in school, that kind of thing. But definitely rest and ice is huge in the beginning.
All right. So we're resting, we're icing, we're trying to do all those things, especially if it's ourselves or our child. To your point, I think you talked a bit about this, but Brandon, maybe you can expand upon it. So when should I make an appointment to see someone who specializes in ortho? Should I go right away? Is it an emergency? Can I wait? What triggers me to say, I really need to see someone about this injury?
Yeah, that's a great question. I think a question that a lot of parents and people debate about when to call the provider or go to the emergency room or urgent care. I think a lot depends on the type of injury. Obviously, if there's a lot of pain, severe swelling, inability to weight bear, or put pressure on the injured site, that's probably an indication that further intervention or further workup needs to be considered. So that's when I would definitely recommend having an injury be evaluated sooner than later. Now, if it's general muscle soreness, you wake up and you're generally sore, achy, I think you try the home remedies first, like Jason was talking about: rest, ice, compression, and over-the-counter medication, as long as it's been cleared, that you've been able to take in the past. Those are things that you can use to try to see if it can get better on its own in a couple of days. And then if it doesn't seem to improve, then I think that's when you can contact a medical provider to have a further workup.
Great. So kind of use those tips and tricks to say, hey, I think I can wait, or no, I think this is immediate. I do have a couple questions from our audience I'm going to toss out here. So my shins and knees are sore after a jog. Should I stretch more before or after? Could it be my sneakers, ? Or just old age? Again, audience question, not my question, but what do you suggest for someone who's sore after jogging?
So I think the biggest thing is obviously evaluating what activity you're doing. So if you're running and jogging, how far you're going, how long have you been doing it? Have you built up? Basically into any activity, you should kind of work into it gradually. Getting back to, preventing injury, proper gear, proper shoes, sneakers are all things that need to be considered. You don't want to wear something that's older or worn out, because that will definitely lead to, issues after. Age, I don't think plays a role in any of this. I mean, obviously we get older, there's a higher risk of injury, but I think, as long as you're doing these other things, working on strength training and, flexibility and wearing the proper gear and making sure that you're doing the activity the way it's supposed to be done, that should in itself allow you to reduce the risk, but also, hopefully prevent those aches and pains from happening during the activity.
Specifically with the shin problem specifically, lots of times that's because your muscle's overworked for some reason. There's too much load on that muscle. That's why it's bothering you. So like he said, you can change the frequency, duration, intensity of the exercise itself. You also might want to look at how you're doing it, because specifically with the shin problem, it's usually that you're reaching for ground, or you're trying to come out and grab ground with your heel, and that puts an undue stress on the shin muscle. And what you might want to try to work on is working on how you're running. And if you more push the ground away, try to push the ground away instead of reaching for ground, that's a really common problem with newer runners. So having someone that might know a little bit about running, look at, you could even be a friend or someone who's been running for a long time. They might offer some suggestions as well to help you with your running style, because it's most likely there's some mechanical stuff going on too with your running. And that might be related to some weakness or some range of motion issues too, because if you have type hip flexors, that's going to keep you from pushing off, or if you're weak in your glutes that might keep you from pushing off from your hip. So so seeking out some professional might not be the worst thing in the world. If you're going to spend time and energy running and making that part of your routine, then it might be worth, spending a little bit of time, energy, and some of those resources into, perfecting it a little bit too.
Great.
Yeah, I would agree with Jason on that. Always, evaluating the gait and making sure that your mechanics are what they're supposed to be, because that will definitely help reduce the likelihood of further injury or correct the problem that's going on.
Great. I think those are very informative things to answer that question. And the main thing I heard you both say, and don't give up, keep on trying and running, and just get some advice, and those might help some of those pains and aches go away. The next question is, my daughter plays high school lacrosse. What type of exercises should she do in the off season to make her stronger, faster, better on the field?
Well, that's a lot. There's a lot there. But basically, when you're looking at performance, I definitely, with any kind of performance program, there's always going to be an off-season program. That's where you really want to put the bulk of your strengthening in, because let's face it, like when you're running around the field all season long, you're going to get your cardio in there. So you really want to periodize it and focus more on the strengthening piece, and that's going to help you maintain all of that work during that workload during the year. And you will actually lose muscle mass during the year as well, because you're running so much. Your body actually will eat itself, so to speak, just like it would eat fat. You can imagine when you're exercising, and your muscles are similar. They're energy storage too. So your body will eat that up too. So you want to try to increase that a little bit during the off season. So usually weight bearing exercises are key, especially lower extremity with the lacrosse players. And that's, your squats, your lunges, your deadlifts, basically, but you have to put a good load on to create muscle mass. So that's something that will require some type of supervision of somebody that knows what they're doing, and at least be able to be taught what to do the right way, because doing the things the right way, just like with the running, this is very important, or you can end up with your own injury from trying to do your workout. The other thing I would say is, like, make sure there's a neuromuscular component to it. There's been many studies out there that have shown that doing neuromuscular re-education, like how to plant your foot when you're cutting. And in lacrosse specifically, there's a lot of cutting, and that has actually been shown to be one of the major reasons for non-contact injuries related to the ACL. So that is a really important thing to focus on, and try to teach people, or try to learn how to cut appropriately, and make sure you're shifting your weight the right way. Your center of gravity is in the right spot. So it gets very technical, right? So like this is where, like, a coach, either a strength coach or a speed coach, or just any lacrosse coach would help you move in the right direction. So definitely weights to increase load, and also some neuromuscular education, so you can learn that stuff and bring it to the field with you during the season. Got anything to add there, Brandon?
That's great.
Yeah, I mean, I would totally agree with Jason. I know with my own team, and Jason's actually worked with us in the past, where we've, implemented strength training in the off season, over the winter and in early spring, getting ready for the season, knowing that that's where a bulk of that work has to be done, so that when we get to the field, we reduce those risk of injuries and increase performance. It's all, comes back to, the prevention point, technique, making sure that you're doing the things correctly, and the proper strength training to make sure that you can take the load of the change in direction and activities while you're participating. So I would agree with Jason. I mean, it's helpful in those situations to have somebody overseeing what you're doing, to make sure you're doing things correctly, because you can, injure yourself, and you can do yourself harm if you're not doing the exercises correctly, or you're not performing to a proper technique. So again, that's the biggest thing, is, making sure that you have good observation, somebody's overseeing it, and, you're working on that strength and stability.
There are programs that are available online that if you, with a quick search, that can be modified even for lacrosse, that they meant for, like, I'm thinking of like the FIFA 11 that is for soccer, but it could be very adaptable to lacrosse as well. So there's injury prevention, performance enhancement programs out there that have been proven to reduce injury, and that are really easy to do, that you could do in your backyard. So there's that stuff out there too.
That's a great resource. Thank you. So if you're like me, you've learned so much from this presentation, and I'm reminded as I'm listening to you both, the impact that you have on the community, whether it's through the Center for Orthopedic Care or through our physical therapy rehab services department, and both are available to you. So if you need that resource, please reach out to us here at Oswego Health. We're happy to have you come and see us anytime. The next thing is, that's going to wrap up our edition of Healthier You for today, but we're going to be back with you in July for another episode. I hope you've enjoyed today as much as I have. I want to thank you, Jason and Brandon, for joining me, and we'll see you next time here on Healthier You.
Thank you very much.
Thank you.